Over the next few minutes, you'll discover the symptoms and causes, treatments, and how to prevent syphilis. Syphilis is a bacterial infection that is usually spread through sexual contact. This disease begins as a painless sore, usually on the genitals, rectum, or mouth. Syphilis is spread from person to person through the skin or mucous membrane contact with these sores. After the initial infection, the syphilis bacteria can remain in the patient's body for decades before becoming active again. Early syphilis can be cured, sometimes with a single penicillin injection. Without treatment, syphilis can seriously damage the heart, brain, or other organs, and can be life-threatening. Syphilis can also be passed from mother to unborn baby. Stages and symptoms of syphilis. Syphilis develops gradually and the symptoms vary at each stage. However, the stages may overlap and the symptoms don't always occur in the same order. A person may be infected with syphilis and have no symptoms for years. The following is an explanation of the stages and symptoms of syphilis that can be identified. 1. Primary syphilis. The first sign of syphilis is a small sore called a chancre. Pain can appear where the bacteria entered the body. While most people infected with syphilis develop only one chancre, some people can develop multiple chancres. The chancre usually develops about 3 weeks after exposure. Many people who have syphilis don't pay attention to the chance because it's usually painless, and it may be hidden in the vagina or rectum. The chancre will heal on its own in 3 to 6 weeks. 2. Secondary syphilis. Within a few weeks of healing the initial chancre, the sufferer may turn to experience a rash that starts in one part of the body but can eventually cover the whole body, even to the palms of the hands and feet. This rash is usually not itchy and may be accompanied by sores such as warts on the mouth or genital area. At this stage of syphilis, some people may also experience a number of symptoms, such as hair loss, muscle pain, fever, sore throat, swollen lymph nodes, weight loss. Signs and symptoms of syphilis may disappear within a few weeks or come and go repeatedly over a year. 3. Latent syphilis. If the patient is not treated for syphilis, the disease can move from the second stage to the hidden, latent stage, when they have no symptoms. The latent stage can last for years. Signs and symptoms of syphilis in the latent stage may never return or the disease may progress to the tertiary stage. 4. Tertiary syphilis. About 15 to 30% of people infected with syphilis who do not get treatment will experience a complication known as advanced syphilis tertiary. At an advanced stage, syphilis can damage the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. This problem can occur years after the original untreated infection. The cause of syphilis is a bacterium called Treponema pallidum. The most common route of transmission is through contact with the wound of an infected person during sexual activity. Bacteria enter the body through small cuts or blisters on the skin or mucous membranes. Syphilis is contagious during the primary and secondary stages, and sometimes in the early latent period. Less commonly, syphilis can be spread by unprotected direct contact with active lesions, such as when kissing, or through an infected mother to her baby during pregnancy or childbirth, congenital syphilis. Keep in mind, syphilis cannot be caught through toilets, tubs, clothing, or the same eating utensils, or from doorknobs, swimming pools, or hot tubs. Once cured, syphilis will not recur on its own. However, a person can become reinfected if they come in contact with someone else's syphilis sores. Risk factors for syphilis. A person has a higher risk of developing syphilis if having sex without a condom, having sex with multiple partners. A man who has sex with a man is infected with HIV, the virus that causes AIDS. Complications of syphilis. Without treatment, syphilis can cause damage throughout the body. Syphilis also increases the risk of HIV infection and for women, can cause problems during pregnancy. Treatment can help prevent future damage, but it cannot repair or reverse the damage that has already occurred. Here are some of the possible complications of syphilis that can occur. 1. Small lumps or tumors. Called gumma, these lumps can develop on the skin, bones, liver, or other organs in the late stages of syphilis. Gumma usually goes away after treatment with antibiotics. 2. Neurological problems. Syphilis can cause a number of problems in the nervous system, including headache, stroke, meningitis, hearing loss, vision problems, blindness, dementia, loss of pain and temperature sensation, sexual dysfunction in men, impotence, bladder incontinence. 3. Cardiovascular problems. These may include swelling, aneurysm, and inflammation of the aorta, the body's main artery, and other blood vessels. Syphilis can also damage heart valves. 4. HIV infection. Adults with sexually transmitted syphilis or other genital ulcers are estimated to have a 2 to 5-fold risk of acquiring HIV. Syphilis sores can bleed easily, providing an easy way for HIV to enter the bloodstream during sexual activity. 5. Complications of pregnancy and childbirth. If pregnant, a woman can pass syphilis to her unborn baby. Congenital syphilis greatly increases the risk of miscarriage, stillbirth, or death of a newborn within a few days of birth. Syphilis diagnosis. If you think you or your child may have syphilis, just visit the doctor immediately. The doctor will take a blood sample to run the test, and they will also perform a thorough physical examination. If there is a wound, the doctor may take a sample from the wound to determine whether there is syphilis bacteria. If your doctor suspects that you have nervous system problems due to tertiary syphilis, you may need a lumbar puncture or spinal tap. During this procedure, spinal fluid collects so that the doctor can test for syphilis bacteria. If you are pregnant, your doctor may screen you for syphilis because bacteria can be in your body without you knowing it. This examination is to prevent the fetus from becoming infected with congenital syphilis. Congenital syphilis can cause severe damage to newborns and can even be fatal. How to treat and cure syphilis. Primary and secondary syphilis is easily treated with penicillin injections. Penicillin is one of the most widely used antibiotics and is usually effective in treating syphilis. People who are allergic to penicillin are likely to be treated with a different antibiotic, such as doxycycline, azithromycin, ceftriaxone. If a person has neurosyphilis, they may receive a daily dose of penicillin intravenously. These often require a brief stay in the hospital. Unfortunately, the damage from late syphilis cannot be reversed. Bacteria can be killed, but treatment will most likely focus on reducing pain and discomfort. During treatment, a person with syphilis will usually be asked to avoid sexual contact until all the wounds on the body have healed and the doctor tells you that it is safe to resume sex. If they are sexually active, their partners must also be treated. Do not continue the sexual activity until the patient and their partner have finished treatment. How to prevent syphilis. The best way to prevent syphilis is to practice safe sex. Use condoms during all types of sexual contact. Additionally, it may be useful to use a dental dam, square piece of latex, or condoms during oral sex. Avoid sharing sex toys. Screen for sexually transmitted diseases, STDs, and talk to your partner about the results. Syphilis can also be transmitted through shared needles. So, avoid sharing needles when using injectable drugs. Stay fit. Stay healthy. Thanks for watching. If you liked this video, hit the subscribe button to receive more like it in the future. Click the link in the description for more information.